All right, welcome. Today, we are digging into the hard data to uncover the biggest risks your clients in Singapore are really facing. We're going to break down the numbers and turn them into the conversations you absolutely need to be having. Let's get right into it. So, I want to start with a question for you. What if your client's financial security, their independence in their golden years, what if it all came down to a simple coin toss? Heads, they're fine. Tails, they faced a really devastating financial challenge. I know it sounds extreme, but the data suggests this is way closer to reality than any of us would like to think. Because the odds are exactly that. 1 in 2. 50-50. Just let that sink in for a second. These aren't the odds you get at a casino. These are the odds of a major life-altering event happening to the average person right here in Singapore. And here's what that number actually means. It is the lifetime risk that a perfectly healthy 65-year-old will become severely disabled and need long-term care. That coin toss, well, it's not a hypothetical. It's a real projection from the Ministry of Health. And honestly, it's the anchor for our entire discussion today. So why are these odds so stark? Well, you have to understand that this very personal risk, it's happening against the backdrop of a massive, undeniable demographic shift. We have to look at the macro environment to really get why this is so critical for your client's plans. And here's the core number right here. By 2030, which is just around the corner, a quarter of the entire population will be over 65. I mean, think about that. That's up from 1 in 7 just back in 2018. This isn't just a statistic. It means a higher burden of chronic disease and a seriously escalating need for solid financial protection. Okay, with that big picture in mind, let's zoom in and diagnose the specific protection gaps that your clients are most likely dealing with right now. We'll start with two of the most foundational pieces of any financial plan: mortality and critical illness. What's really interesting here is that even when we talk about death coverage, the most basic form of protection, the average working adult is still 21% short of what their family would actually need. We kind of think of this as a solved problem, but the data clearly shows there's still a pretty big gap to close. But as concerning as that mortality gap is, it is absolutely dwarfed by this: a 74% shortfall in critical illness coverage. Let me say that again, 74%. This means the average person has only about a quarter of the financial resources they need to handle a major illness without completely derailing their family's future. This right here, this is the biggest, most urgent gap you need to be talking about. So what does that shortfall look like in real dollars? Well, the average critical illness claim pays out just $52,000. So just ask yourself, for your middle-aged client, the one with a mortgage and kids, is 52 grand really enough to cover treatment, replace their lost income, and actually allow for a proper recovery? For almost everyone, the answer is a hard no. And let's be crystal clear about what we're protecting against. Yeah, there are 37 defined critical illnesses, but get this: over 90% of all claims come from just these three: cancer, stroke, and heart attack. So the key here is to focus the conversation on these high-probability events that clients can immediately understand and relate to. Okay, now let's bring it all back to where we started, that 50-50 risk of severe disability. Now that we've seen the massive critical illness gap, we can really start to understand the financial reality of needing long-term care, which, by the way, is a very common outcome after surviving something like a major stroke. This slide just lays it out so clearly. The national scheme, CareShield Life, provides a vital safety net. We're talking around $700 or so a month, but the actual cost of a nursing home, even after subsidies, is somewhere between $2,000 and $3,500. That leaves a monthly gap of thousands of dollars that someone has to pay, month after month. And this isn't a short-term issue. The median length of time someone needs this kind of care is 4 years. But look at this. For nearly a third of people, that period of high-cost care lasts for a decade or even more. A 10-year care journey could completely wipe out a lifetime of retirement savings if it's not properly planned for. So we've got existing gaps and these scary long-term risks. But the next challenge is that the goalposts are moving. The cost of healthcare is going up, and it's going up fast. And what that means for your clients is that waiting to get covered is a financially risky strategy. Just look at the national spending. It's projected to jump from $22 billion to $59 billion by 2030. Now, that's not just some line item in a government budget. That's a near tripling of the costs that eventually trickle down into the hospital bills and the insurance premiums your clients are going to have to face. Now, when we talk about hospital bills, it's so important to know where people are actually getting treated. The data shows that 80% of hospital care happens in public hospitals. This is a fantastic conversation starter. Does your client's desire for private care actually match their level of insurance coverage? Or are they accidentally setting themselves up for a huge out-of-pocket bill? Okay, we've spent a lot of time diagnosing the problems. Now, for the most important part, the solutions. Let's get into the planner's playbook. Clear, actionable steps you can take to build a much more resilient financial plan for every single client you have. First things first, let's put a real number on that massive CI gap. The Life Insurance Association gives us a clear, authoritative benchmark. They recommend coverage of about 3.9 times a person's annual income. This gives you a tangible goal to work towards, moving your clients from that dangerously low 26% coverage level up towards 100%. So here it is. It really boils down to this simple 3-step playbook. 1, check that mortality cover is enough to protect their dependents. 2, you've got to aggressively bridge that CI gap, using the 3.9 times income rule as your guide. And 3, address that 50-50 long-term care risk by supplementing CareShield Life to cover the real monthly costs of care. And if your clients are on the fence, this is the final piece of the puzzle. This is a direct takeaway from all the trend analysis. As the population gets older and claims go up, premiums will inevitably rise. It's just simple math. Locking in coverage now isn't just about protection, it is a sound financial decision that will save them a lot of money in the long run. So, we'll end it here. The demographic shifts, they're already locked in. The protection gaps are clear, and they're quantifiable. The data has basically shown us the future. So the only question left is the advice we're giving our clients today truly ready to meet it?